How to treat overactive bladder. Having an overactive bladder can be downright annoying. You always feel the urge to pee, and sometimes urine even leaks out before you even reach the toilet. It can become so problematic that it affects every aspect of your life. There are several treatment options for an overactive bladder, ranging from therapies and exercises to medications and surgery. Here are some ways on how to treat overactive bladder. 1. Bladder training is one of the most common natural techniques used to treat an overactive bladder. To train your bladder, you try to reduce the frequency of urination by waiting longer and longer before you relieve yourself each time you feel an urge to pee. 2. Exercise your pelvic muscles. You can strengthen the pelvic floor muscles that control your urination with Kegel exercises. Simply tighten, hold, and then relax your pelvic floor muscles 30 to 80 times every day for 8 weeks. Since these exercises are very simple, you can do them even while reading, surfing the internet, or watching television. 3. Try biofeedback treatment. Usually done in conjunction with Kegel exercises, this technique involves using a monitor to measure bodily processes such as heart rate, breathing rate, and body temperature. With guidance from a trained professional, biofeedback can help you control the muscles involved in urination. 4. Undergo pelvic floor electrical stimulation. This involves sending mild electrical impulses to the pelvic floor muscles to stimulate muscle contractions. 5. Change some of your lifestyle habits. Certain things that you regularly do might be contributing to your overactive bladder. If you drink a lot of fluid, you may want to drink less. Your doctor might recommend a certain volume as well as a schedule of when to drink. Avoid drinking fluids before going to bed and before doing activities that won't allow you to go to the toilet whenever you need to. Moreover, if you're overweight, losing some weight can also help you control your overactive bladder, since excess weight puts more stress on the pelvic floor muscles. 6. Minimize caffeine and alcohol intake. Caffeine and alcohol have diuretic effects, meaning these drinks will make you urinate more. Caffeine is not only in coffee, but also in tea, sodas, and energy drinks. Try to avoid drinks with caffeine for 1 week to see if symptoms improve. You should also limit the frequency with which you drink these beverages. 7. Take medications for overactive bladder. When it comes to drugs, the first choice for treating an overactive bladder is anticholinergics like daraphenocin and fesoterodine. They help relax the smooth muscles of the bladder that control urination. Antidiuretics like desmopressin can also reduce urine output, and doctors usually prescribe it for those with an overactive bladder at night while sleeping. For women with menopause, topical estrogen might work, since low levels of estrogen can affect the tissues of the urethra. 8. Consider surgery. If all else fails, surgery is a treatment option. One of the most common surgeries for overactive bladder is sacral nerve stimulation. A device is implanted under the skin to electrically stimulate the sacral nerve to treat overactive bladder. Another surgery, augmentation cystoplasty, involves increasing the bladder's size by adding tissue derived from the intestine. One more treatment route is urinary diversion, which involves rerouting the urinary system so that the ureters, the tubes connecting the kidneys to the bladder, bypass the bladder. Before resorting to medications and surgery, consider other ways on how to treat overactive bladder. These techniques will help you control your bladder and lead a more carefree life.